If sex has become painful because of endometriosis, I want you to know something. You're not imagining it, you're not too sensitive, and you're certainly not alone. In fact, up to 2/3 of women with endometriosis experience pain during or after intercourse. Unfortunately, many women are told to just relax or use more lubrication. While those suggestions may help in certain situations, it completely misses what's actually causing the pain. Hi, I'm Dr. Jeffrey Brown. I'm an osteopathic functional medicine physician, and for more than 15 years, I've helped women uncover the root causes of hormone-related conditions, including endometriosis, adenomyosis, and chronic pelvic pain. Today, I want to talk about 5 reasons why sex hurts when having endometriosis. Because once you understand what's happening inside your body, you can begin addressing the real problem, not just masking the symptoms. It's not just the lesions. Most people assume endometriosis pain only comes from the lesions themselves. But the truth is, painful intercourse is usually much more complex. Several different systems are involved, and they often work together. So let's talk about them today. Reason number 1 is inflammation. It makes everything more sensitive. Endometriosis creates an inflammatory environment inside the pelvis. Your immune system is constantly releasing inflammatory chemicals. These chemicals don't just irritate the lesions, they also irritate nearby nerves and surrounding tissues. Imagine touching your skin that's badly sunburned. Even light pressure hurts. That's what it's like inside the pelvis. Normal movement during intercourse can become extremely painful because the tissues are already inflamed. Reason number 2, your pelvic floor muscles stay guarded. Here's something many people don't think about. Pain causes muscles to tighten. Then those tight muscles create even more pain. Over time, your pelvic floor begins protecting you by staying contracted, even when you're not aware of it. This creates trigger points, muscle spasms, restricted blood flow, and then deeper pain during penetration. Reason number 3, your nervous system becomes overprotective. Pain isn't only about damaged tissue, it's also about how your nervous system processes danger. When you've experienced pelvic pain week after week, month after month, and year after year, your brain begins anticipating pain before anything even happens. Your nervous system becomes hypersensitive. This is called central sensitization. Eventually, even normal sensations can feel painful. Not because you're imagining it, but because your body's alarm system has become stuck in the on position. Reason number 4 is that adhesions can restrict movement. Endometriosis can create scar tissue called adhesions. These adhesions bind organs together that should normally glide freely. The uterus, ovaries, bladder, bowel, even the tissues behind the cervix. During intercourse, these tissues are supposed to move naturally, but when they're restricted by adhesions, that movement can pull and twist on sensitive structures and trigger sharp, deep pelvic pain. And reason number 5, hormones can influence pain. Hormonal fluctuations can increase inflammation throughout the month. Many women notice intercourse hurts more before or during their period. Others notice pain during ovulation. Hormones aren't the main cause, but they can amplify an already sensitive system. So those are the 5 causes of painful intercourse in women with endometriosis. Painful sex affects far more than intimacy. It affects confidence, relationships, marriage, fertility, and emotional well-being. Many women begin avoiding intimacy because they're afraid of the pain. Some feel guilty, others feel broken, but none of this is your fault. Pain changes behavior, and chronic pain changes lives. Now, the good news is that painful sex isn't something you simply have to accept. The goal isn't to push through it. The goal is to understand why it's happening. So when you reduce inflammation and you improve gut health, calm an overactive immune system, support hormone balance, address pelvic floor dysfunction, and retrain an overprotective nervous system, many women experience significant improvements in both pain and their quality of life. Now, that's the difference between chasing symptoms and addressing the root cause. If intercourse has become painful, please don't assume this is just part of being a woman. And don't accept being told everything is normal simply because your imaging or your lab work looks normal. The pain is real, there are biological reasons behind it, and there are often more treatment options than you've been told. Join me in my free monthly webinar where I discuss a root cause approach towards reducing pelvic pain. You can register in the link below.